Go ahead.
All right, good morning, everybody. I just would like to take a few minutes to introduce myself and introduce some of our participants this morning. My name is Carrie Stitsworth, and I am the Physician's Liaison with TheraPlay. I cover our Kennett Square location, our Newark location, and our Middletown location. Today, in conjunction with Hocassin Athletic Club, we are going to be doing a panel on understanding sensory processing in children and adolescents. I'm going to throw it over to Lisa from Hocassin Athletic Club to introduce herself, and then I'm going to introduce everyone to our presenter. Lisa?
Hi, good morning, everyone. My name's Lisa McGuire. I've been with HAC since before we opened. We're really excited about this partnership this morning. If you're tuning in from the HAC community, I know maybe many of you have had a unique opportunity in the last few weeks to kind of see your children in action and maybe learn some new things about the way that they learn, and certainly maybe have some concerns about some of the things you're seeing or questions. So we hope that this is informative and helpful.
So today's presentation is going to be provided by Kelly Rodden, who is our center manager in Kennett Square and in occupational therapist. I'm going to go ahead and introduce Kelly now, and Kelly is going to tell you a little bit about herself and then begin the presentation. Thanks everyone for joining us.
Thanks everyone for joining. Thanks Carrie for the introduction. Again, my name's Kelly. I'm an occupational therapist. I work at our TheraPlay Kennett Square location and also manage that clinic. And this is actually one of my favorite topics to present about. It's one of those things that are near and dear to my heart, understanding sensory processing. There is a chat box. If you guys have any questions, please go ahead and write those questions in. I'm pretty informal, so you know, they can always stop it and ask questions throughout, or we can wait for it at the very end. So let's get started. Alrighty, so like I said, we're going to be talking about understanding sensory processing in children and adolescents. And our objectives really are just understanding what it is, what sensory integration is, the role it plays, and the principles and therapeutic approaches that we use. And sensory processing is very complex. It's never black and white, and I think that's why it's so hard to wrap our head around. We talk about what it is, and it's really truly how we take information in our environment and use it for a functional purpose. It happens in our central nervous system, and it's a reciprocal process with our body, our receptors, and the environment. And why does it happen? It helps us to make sense of our environment, helps us to make sense of our worlds, and enables us to master our environment that we're participating in. How does this happen? It's automatic. It happens through our sensory receptors, and it starts as young as in utero, and it's developing all the way through early adolescence. So Dr. Jean Ayers, she was the doctor that pioneered the principles of the sensory integration theory, and she studied this extensively, and really comes down to being that it's an innate process, and it's child-driven, and the real main goal here is the drive to master one's environment. So we'll keep moving forward to talk a little bit more in detail about the different senses that we see. So when you think of sensory processing, that's just, like I said, a big umbrella term, and then we have all of our senses that fall underneath of that. So we have proprioception, vestibular, tactile, vision, auditory, taste, and smell. So the next couple slides, we'll talk about them in more in detail. So our proprioceptive system, this is a type of input that we get through our receptors of our joints and our muscles, and it helps us give what they call like an internal body map. So it helps us give us that body awareness. It helps us understand like where our body is in space. The biggest thing I always like to talk about is like the example of how to throwing a ball at a target. We're using our proprioceptive system to manage our muscles and our joints appropriately to throw out the right velocity and force. How are we moving our hand and our arm so that we're aiming at the right direction? So again, we're getting that input through our muscles and our joints, and it's giving our brain feedback on how to grade those movements. It could be even as simple as reaching for a cup. There's a cup of water, or you're using a proprioceptive system in our muscles and joints for how are we reaching, how much muscle mass are we utilizing to reach forward? How much pressure are we using to grasp the cup? Or if we squeeze too hard, we're going to spill the cup of water or whatever it is. So your proprioceptive system is really helping us give an idea of where our body is in space and grading those body movements. So the next one we're going to talk about is just the proprioceptive system and how it can differ if we're having some challenges processing this input. So there is the over-responsiveness, under-responsiveness, and then seeking. I want to preface that as we go through all these systems, like I said before, it is definitely not cut dry. You may have a kiddo that's over-responsive in one system and under in another and seeking in another. So as the occupational therapist, that's my job to figure that out. But anywho, so for a proprioceptive system kiddo that has over-responsive to this type of input, they're avoiding these types of strong inputs. They're more rigid, tense, a little uncoordinated. They're not those kids that are seeking any type of like gross motor play at all. Under-responsive is actually the opposite. So they have poor registration of overall body awareness. Those are those kids that are pretty clumsy. They may have low tone. They're not getting the appropriate amount of input to those joints and muscles. And then they may also have difficulty with just dressing orientation. They have no idea where their body is in space. So how are they going to be able to manage how to put on a shirt or put on their pants? And then we also have those kiddos that are seeking that proprioceptive input. So those are those bump and crashers, we like to call them. They're craving those active movements. Very hard time for them to sit still. They love those tight clothing. They need those kids that are always like grasping or reaching for everything too hard. Loving that swaddling. They may even also be those kids that are sitting down, constantly kicking their heels on the ground, or even headbanging can be a kiddo that is seeking that input. To the novel eye, you're looking at that as an injurious behavior or, something like that. But for a kiddo that is seeking this input that helps them feel just right, that's what they need to feel organized. So again, you can see in a variety of different ways, and we're going to talk about this with all of our systems. So moving into the next slide, these are just some examples of ways to get that type of proprioceptive input. Now we can do climbing, scootering, pushing, all different things you can see in these pictures are things that we've done in the clinic, swings, climbing, using a scooter, using your arms and legs, crawling through resistive tunnels. This is all great, but what do we do at home? So proprioceptive input is also the most organizing. So we're constantly using it for these kiddos to help calm and de-escalate any stressful situations. So can we, do yoga in the morning, or can we do pushes on the wall, or, make sure that, they're involved in pushing the laundry basket from the laundry room to the kitchen. So finding those opportunities in the home that we can get them that input that helps them feel organized. Right, next one. So then our vestibular system, or our movement system, works very much closely with vision. And their receptors are in our inner ear. So they're looking at that rotary movement and that linear movement, again, where our head is in space. And it's really looking at how the movement of ourself is within Earth, to be honest. It gives us that readiness state for a muscle to contract. So vestibular input, it's very complicated, like I said, and that we're doing this in a webinar. It can be very, mind-blowing, but it can sometimes look very much like a proprioceptive kiddo, but it may be vestibular. So we'll talk about that in the next slide, about those under and over responses and what that looks like. So with those over responsive kiddos, these are, you can go to the next slide. So for our over responsive kiddos, these are those kids that are intolerant of movement. So again, they're more sedentary in their play. They may be more cautious in their play. They're not climbing up on the jungle gym like the rest of their peers, avoiding swings. They may even show some gravitational insecurity. So something as simple as, laying down to put on your pants, or a young baby being able to lay them down to put on their diaper causes them distress because their head is going backwards. So they may have an over response to that type of movement sensation. Under responsiveness, the opposite, poor registration. So we may be able to move constantly and we're not getting dizzy. We're spinning around and there's no dizziness whatsoever. There is a decreased response to those protective extensive reflexes. So when you're falling, the kid isn't putting their hands out to grasp the ground, they're just falling and hitting their head because, again, they're not realizing that their body is moving in the direction that it is at the fast velocity that it is moving. So those might be those kiddos that do appear clumsy or are hurting themselves, falling a lot. And then we have those thrill seekers, those seeking kiddos that are constantly using that input just to help them feel organized. So we can move on to the next one. So again, other things that we'll do to help address some vestibular input opportunities for swinging. We have a barrel here, we roll. All those things are great for the clinic, but what can you do at home? There are opportunities that you can get that type of input. May it be jumping up and down, may it be doing log rolls down the hallway or in your living room. Doing simple like supine to sit, on your back to sitting up, input, rocking. All of those things are different ways that you can get that type of input. Now, again, it's not one size fits all, as you'll see as I continue to go on through all these systems. It's very individualized for the child. What may, be organizing for one kid may rev up another kid. So again, you want to consult with an occupational therapist to figure out what's the best, formula for your kiddo. But these are some things that you guys can trial and just be more aware of what could be going on with the kiddo. All right, and then the next system is our tactile system. So we have 2 tracks in our sensory system, in our tactile system, that help us to receive tactile input. We have our ventral spinothalamic tract, and then we also have our dorsal column. Our ventral tract is taking in those responses of pain, temperature, that fight or flight reaction is where we're really getting a lot of those responses. And then our dorsal column is actually a higher level of response system. So that's where we're trying to distinguish, that 2-point discrimination. We're trying to, the sterignosis is where like you're able to close your eyes and hold something in your hand and kind of perceive what it is without using your vision. So that's getting processed through your dorsal column. What's super interesting about this is that our our dorsal tract can actually help to inhibit the spinal thalamic tract. So for instance, should you get a cut, right? That's getting pain through our ventral spinal tract. What we can do is provide some deep pressure, which is one of the sensations that the dorsal column is, to help relieve some of that pain. So you can utilize your tactile system in a strategic way to help inhibit some of that fight or flight response. Deep pressure is a really big one that we use all the time. So if we're having an aversive tactile experience, can we provide some deep pressure to help calm that sensory system? 9 out of 10, it does definitely help. Again, not one size fits all, but it is something interesting to be aware of, that we can kind of play around with our tactile system with different sensory inputs. So again, we have their over-responsive, under-responsive, and those seeking. For over-responsiveness kiddos, for the tactile input, these are those kids that have high anxiety. They have, those, maybe the tags are bothering them, unexpected touch is really driving them crazy. These may also be kiddos that are up on their toes when they're walking. The different sensations on the ground is too much input for them, so that they're all up on their toes. It could be an orthopedic issue, but it could also start with a sensory issue, for which now we have tightness in our hamstrings, or I'm sorry, our calves there. These are also those kiddos that could possibly be picky eaters. So we're thinking tactile system in our skin receptors, but don't forget about our mouth. Some kiddos can't tolerate a variety of different textures in their mouth. That causes them to be discomforted. So again, just being aware of that. We have our under-responsive kiddos that just have that poor registration. They have decreased awareness of any tactile input. They're, they could be completely disheveled and they have no idea. So the complete opposite of over-responsive kiddos. They're those kids that can have food all over their face and they have no awareness of it. And then we have those seeking kids that are just constantly looking for that tactile stimulation. The kids that are flipping over the bins of of toys and just kind of scavenging through them. I'm loving that messy play. Again, we can see it in a variety of different ways. So some tactile strategies that we can utilize: deep squishes, hugs. Like I said, really great for deep pressure, help organizing, decreasing some of that anxiety, you know, giving them some opportunities to get that deep pressure, may it be through crawling over pillows, to just giving themselves a hug if they're old enough. And then we also use a different type of approach, which you'll see in the last picture here, therapeutic brushing. So brushing is another technique that provides stimulation to the skin and joint receptors as well, because we're also encouraging some proprioceptive strategies within this technique. And what this is doing is providing some nice deep pressure to the skin, bringing awareness and organizing for that. So again, just another approach that we can utilize to help regulate that tactile system.
And Kelly, we do have a quick question.
Yeah.
The question is, for giving tactile pressure, should the pressure be given around the area where they are feeling the undesirable texture, or can the pressure be given on any parts of the body?
From my experience, I think it's best to do the entire body, to be honest with you. If you think about it, if you're just localizing to that one area, it's not going to help regulate it as much. Now, when you think of somebody getting a cut, obviously the deep pressure is helping that one area. But when we're having like a tactile aversion where, you know, maybe it's our clothing or something that is really bothering us, if we can give that input to majority of our body, it's going to help us de-escalate that anxiety state faster than if we're just focusing on that one specific limb or part of your body. So again, nice, slow, controlled, deep pressure. I always, you know, with my kiddos, I always start up high and move myself down, again with the legs, getting them encouraged to do it as well, give themselves hugs. So I would say if you're able to and they're tolerating you being able to give that amount of hand over hand assistance, go for it. But some kids may not tolerate it. So again, one size doesn't fit all, but that's what I would suggest. Okay. So then our visual system. Unlike sight, so it's different than our sight, it develops just as our senses integrate together. So it's pretty complex. It's looking at our perceiving different forms, patterns, figures, and of course, if our visual system is off, that's going to impact our eye-hand coordination, our visual motor skills. It shares such a strong connection to our vestibular system, so our movement-based system. It's providing info of where our head is in space, and so it helps us understand that spatial perception, like our, you know, our body awareness, and, you know, how close we are to somebody or anything like that. So again, you'll see how a lot of these systems are very much connected, and they actually are all connected, but how, if one is off, how it can affect another one. So again, as an occupational therapist, that's my job to figure out what system is off and how can we provide the appropriate strategies and support so that the other system is more regulated as well. So just like every other system, we have our over-responsive, under-responsive, and seeking. So those over-responsiveness kiddos, they're those kiddos that have that overreaction to that environmental stimuli. So they may be disturbed by moving objects, car rides maybe a lot, and that could be for a variety of reasons. It could be because of the visual system, that the objects moving out the window are moving too fast, or it could be their vestibular system because their body is moving in space and their head is like, where are we? The car is moving, but I feel static. So again, very much linked to vestibular. Those could also be those kids that are very disturbed by bright lights. Carnival lights may bother them. Even just turning on the lights in the morning may put them in complete distress. Now, be mindful that, you know, just like you and I, if the lights get turned on in the morning, I'm not the happiest camper because I want to continue sleeping. But when it gets to a point where it's bigger of a reaction than typical, you're noticing it across a couple days and environments and settings, then there might be some over-responsiveness to that visual input. We have those under-responsive kiddos, the ones that have a decreased response, poor attention, just really missing a lot of that visual input that they should be getting. And then there's those seeking kiddos, where they have that extensive time in front of television. They love the flashing lights. Those could also be those kiddos that you see that are just kind of like waving their hand in front of their face. This, for them, may be that visual input that they need to feel organized. It may be nothing but, hey, this makes me feel calm, this makes me feel good. They're seeking some visual stimulation, and that's what they learn to help them get that. All right, the next one we have is our auditory system. So this is our ability to discriminate and filter out sounds. Of course, this impacts our attention, our focus, and awareness of the environment. And like all the other systems, we can see an over-responsiveness, under-responsiveness, and seeking. You can go to the next slide. So with those over-responsiveness, this is those kids that have auditory defensiveness. They may always be on alert. They are those ones that are really easily distracted. They are also those kiddos that are constantly complaining about house floor noises, maybe. So the vacuum goes off and it throws them a complete fit, or some of those automatic bathroom stalls when the toilet flushes, that throws them into a fight or flight reaction. We have those under-responsiveness kiddos. They're unaware of surrounding sounds. This is different than the kids just not responding to their name being called because they hear you and they just don't want to listen. There are kids that truly are completely unaware that their name is being called because they're just not aware of surrounding sounds, and they're unable to filter out what is they're supposed to focus in on. And then we have the seeking, the kids that are loving those loud noises. They may even be talking really loud, but they don't realize it because that's what's making them feel good. Their volume of their tone is getting responded in their auditory system as typical for what they would look at as typical. But for the rest of the group, they'd be like, well, you know, why is Johnny so loud? So again, you can see a combination with this as well.
And then Kelly,
yeah,
we do have a question.
Sure.
What is the difference really between the over-responsive and the seeking? Can a child be both?
Yeah, so there is a difference, and it's and it all has to do with I think what everyone always looks at is they're like, oh, it's a sensory seeking kiddo. That's what it is. They're definitely seeking that input. But what could happen is with the over-responsiveness, so if they're, wait, I think I'm getting confused now with the auditory defensiveness. Yeah, so if they're over-responsive, they're the kiddos that are disturbed by this type of input. So it's different than seeking. So it might be, are you thinking about the difference between under-responsive and seeking?
The question says between the over-responsive and the seeking.
Okay, so the over-responsive would be the kiddos that are actually defensive to this type of input. So for movement, I think is one of the easiest ones for me to describe. So for a kid that is over-responsive to movement, they will not tolerate moving, you know, up and down, left and right, head moving, all of that. That puts them in distress. They have some, you know, distress and gravitational insecurities. You know, that causes a fight or flight reaction. Where seeking would be the opposite in that they're seeking that movement. So what I would say, there is a hard line between under-responsiveness and seeking. So those kiddos that are under-responsiveness, they also can look like a seeking kiddo. So they aren't responding to as much of the movement sensation. So it looks like that they're seeking it out. The difference is that if we are prescribing them the right exercises, that those kiddos that are the under-responsive kids, they can get a certain type of exercise and input to help them get to that just right level. It may be different than the kid that's seeking. So the kid that's seeking may need, you know, a whole more gamut of different types of exercises than an under-responsive kiddo. So it's never black and white. And again, they look very similar, the under-responsiveness and seeking kiddos. But we're looking at all the sensory systems. So could this kid be seeking one area because they're over-responsive in another sensory system? So it is very complex and it is very not black and white, but we're looking at all the systems because, again, I may be able to provide some proprioceptive input to a kiddo, and next thing you know, we're seeking less movement. And it was really because, our proprioceptive system was off. So again, they all are correlated, and it's my job to figure out where they fall, but it's not black and white either. So I'm hoping that answers your question. I would say the under-responsiveness and seeking can look very similar.
Great, thank you.
Okay. So then it brings us to taste and smell. I find that a lot of times when we have difficulties with taste, feeding difficulties, we also have some issues with our tactile system as well. So tastes and smells are our ability to discriminate the differences in taste and smell within the surrounding environment. And the biggest thing that I would say to be aware of is that our olfactory system, so our senses in our mouth, it has such strong ties to our hippocampus, which is part of our brain that is very much related to processing memories and emotions. So any child that has a negative association or a hyperreactive sensation to any type of taste, that's going to get stored into their memory a lot more than maybe another sensation. So all the time we work a lot with like feeding therapy. It's a completely separate intervention plan that we'll utilize, again, looking at sensory in general, but the main focus here is making sure that mealtime is positive, especially when we have that restricted diet. We're pushing food out of our diet because we don't want to develop those memories that are going to, down the line, impact their ability to tolerate those true different tastes and smells. So then over to, again, over-responsive, under-responsive, seeking. So those over-responsive kiddos, they're avoiding certain tastes and textures. Maybe they're avoiding puree. They can't tolerate the softness, or maybe they're avoiding the chewiness. The under-responsive kiddos are completely oblivious to that. They're really just having no response to it whatsoever. They may not be interested in mealtime for that reason. And then seeking are those kids that are seeking that type of sensation. So they're constantly smelling things. They are preferring like the really spicy stuff because that gives them a lot of input there. That helps them feel organized in that way. So again, you can see a combination. I find that a lot of times when we have kiddos that come to me for feeding, it's usually that over-responsiveness to the tactile input and the taste that we're working on. And really a lot of it is just coaching families on how to make mealtime positive to support that memory connection.
And then we do actually have another question.
Okay.
With regards to taste and smell, what if kids are licking objects, toys, or items on the playground?
So that could be a kiddo that is seeking some of that. It could be tactile, or it could be a taste thing too. It could be a combination because again, you have those tactile receptors in your tongue. With those types of kiddos, they are seeking that input, so that makes them feel good. So can we give them something that is more appropriate for them to get that input in another more appropriate way than licking playground equipment? So there's like chewy tubes. I always ask families about their diet. Are they getting a variety of different foods and textures and tastes? Because that could impact their, the input that they're getting to their mouth and what they need more of. I also look at their other sensory systems. Because again, is there something else that is off in a different sensory system that is now being shown through taste and smell? Because again, they are all very much connected. I'll never forget, this isn't related to taste and smell, but it talks about how it's such a puzzle. I had a kiddo that came here that we thought needed, had off was his proprioceptive system. He was seeing PT because he was clumsy and all of that. PT was working on him, trying to build strength. Everything was fine. They referred to OT. I was working with him, trying to give him that proprioceptive input because that's what initially I thought was off. Next thing you know, we're walking on them, balance being falling all over the place. Next thing you know, I put them on a swing. I give them nice, intensive vestibular input, rotary movement, linear movement, you name it. The kid came off and he walked beautifully on the balance beam. So we were off initially. We were like, oh, it wasn't his proprioceptive system. It was it looked like it was because he was falling all over, he had no body awareness whatsoever, but actually he was completely off in his vestibular system. We just gave him the appropriate tools to address that, and now his proprioceptive system is able to work appropriately. So again, looking for those alternatives for where they can get that input. So those oral tools, they may be helpful, looking at the diet, but then also looking at the other systems. Could there be something off that is now mirroring or producing some type of different reaction in another system? Again, not black and white, and it's hard to kind of wrap your head around it sometimes, but that's what I would say would be my thought on that one.
Okay, and then another quick one would be, is a child that excessively drools related to the sensory system?
It could be. It could be due to completely under responsiveness to their proprioceptive system in their mouth. You know, they have no awareness of the muscles and joints in their mouth. It could be a weakness thing, right? They could truly have weak oral muscles, and that resorts in drooling. To help problem solve that is, how are they doing in mealtime? Are they able to progress to the different textures? Are they able to manage those tougher textures? If they are able to manage it, it may not be so much of a strength thing. It could truly just be they're not getting enough response to their mouth. So there's different strategies that I try all the time to increase that awareness. Can we do some vibration in their mouth? Can we give them some nice cold compresses or play with ice as a nice intense tactile experience to wake up those receptors in our mouth? So there's a bunch of different ways to help support those types of kiddos, but that's what you have to tease out. Is it truly a oral muscle weakness, or is it a sensory challenge? Okay. So then motor planning, this term is the result of efficient sensory processing. It's completely unconscious. It helps us to plan, organize, and carry out a movement. This is what we are aiming for. When we have efficient sensory processing, all of our sensory systems are working together nicely. We're feeling just right and organized. We are seeing appropriate motor planning, and this can be seen in daily routines of dressing. This can be seen in play routines, sports, school performance, all of that. So this is our end all goal when we have efficient sensory processing. And then it talks a little bit more on our next slide just about what sensory integration is. And it really truly is all the senses working together, and how we are developing and learning by looking at our environment, perceiving the information in the environment, interpreting what that means, and then making appropriate adaptations and accommodations to respond. The example of a ball toss is a perfect example. So if I'm throwing somebody a ball, are we able to use our visual system to detect and perceive the information? Am I looking at the person holding the ball? Can I see the environment around me? They now throw it, and I'm watching it. I'm perceiving what that means. I'm understanding, it's coming towards me. Now, how do I make sure that I have an appropriate response? Do I need to step forward? Do I need to use my proprioceptive and vestibular system to step forward or to the left or to the right? How much pressure do I have to go to grab the ball? So again, sensory integration is truly taking all of our senses, they're working together, they're promoting appropriate motor planning, and they're helping our body and brain work together to master our environment. So this is 2 videos. The first video is of a 3-year-old boy. He was delayed with milestones. He's working on bilateral hand skills, and he's getting some nice sensory input from the tire to help keep him focused. So we can play that. So I don't know if there's volume, but I can just kind of talk through it a little bit. So this is a kiddo. I don't know him personally, but he must have, poor body awareness. He may be a kiddo that is seeking input in some type of way. And so what the therapist is utilizing is the tire swing. It's giving him some nice deep pressure when he's sitting on it. It's kind of grasping him a little bit. It's giving him some movement. You saw initially he started bouncing, so that's what's making him feel good. And the goal here was to increase his body awareness. She was having him try to cross midline. Some kids that have poor motor planning, they're unable to see that their body has 2 sides and they can reach across their body and do things on the opposite side of their body with the other hand. So she was encouraging that. And as he started getting the appropriate sensory input from the swing and the movement piece and the deep pressure piece, his efficiency of crossing midline required a lot less assistance and a lot less cues. So then this next one is a 3-year-old boy, and I'm sorry, that first video is not a 3-year-old boy, I just realized. That kid's a little older, but this video is a younger boy who had delayed milestones, who's receiving occupational therapy. He's rolling over a peanut ball, which is kind of like a therapy ball, shaped like a peanut, collecting puzzle pieces from a sensory bin. He's receiving some nice calming proprioceptive input to prepare him for his therapy session. So we'll watch some of this. So again, he's weight bearing through his arms, putting pressure through his hands, his joints, his muscle receptors. He's also getting some nice other tactile input by digging through rice to give some tactile input to his hands there. Also getting some nice deep pressure by the peanut ball, giving some nice response, that deep pressure response to him. So a lot of times kids may not need it all the time. They may need just a little sensory warmth in the beginning to help them stay focused for maybe a tabletop activity. So again, that's something that we would tease out, but you can utilize different approaches and input to support, whatever goal it is that they need to be able to efficiently perform. Okay, so then this is a big one. I feel like sometimes we should have just a whole presentation on just the behavioral component and how it relates to sensory processing. So how do we tease out, is it a behavior or is it sensory? And a lot of times it's both. So what I typically see is these kiddos had a sensory challenge in the past and they dealt with it how they did. They learned how to avoid it. They developed a learned behavior that could have been yelling, screaming, throwing, whatever it was. They had developed a behavior that got them out of whatever sensory sensation that was, aversive to them at the time. And so, our job is to figure out, is it behavior or is it sensory? Like I said, a lot of times it's both. So we're working to develop appropriate plans to help address that sensory underlying concern that has not been addressed, but then also providing some behavioral support. Now, I'm not a behavioral therapist. If it is out of my scope, I would absolutely refer out, but we do have a lot of different behavioral strategies and programs that work really nicely with the sensory integration approach that we'll utilize to address both of those components so that the child can be more successful and carrying that out at home. So then the next couple slides talk a lot about ADHD and sensory processing disorder. I have seen before the pandemic, a huge increase in the number of kiddos that have been getting diagnosed with ADHD. Now, if you think about our world, the world that we live in is a lot more sedentary. This is prior to the pandemic shutdown. Everything is electronic. We're, taking recess away as a punishment. There's less opportunities for kids to run outside. We have TV, video games, all of that. There's a lot less opportunities for kids to explore their environment and get the appropriate input that they need to develop their sensory system. So what the next couple slides talk about is how ADHD and sensory processing disorder, these signs and symptoms almost mirror each other. There is a difference. The difference is if it's true ADHD, this would be treated with medication, behavioral therapy. If it's sensory processing disorder, it could be treated with sensory integration and occupational therapy. So if we go to the next slide, it talks about, this is just even more talking about the difference between ADHD and how if it truly is ADHD, medication should help. Again, if you look at it, their signs and symptoms are almost identical when you put them side to side. And then the next slide talks about a specific study that they did that showed that with a group of kiddos that were described as having ADHD problems or whatever, were provided sensory integration intervention. And from the results, they found that 95% improved in their overall sensory challenges, impulsivity, what have you, through that sensory integration occupational therapy treatment. So what I always say when I go out educating families, doctors on sensory integration, I say, listen, let's try the sensory approach first, because there's a very high probability that this kiddo actually truly doesn't have ADHD, and putting them on medication really will not change too much, and it could be an underlying sensory processing challenge. Now, could this kiddo have ADHD and sensory processing disorder? Absolutely. But my approach is, hey, let's try to address the sensory challenges first, provide what we like to call a sensory diet, which is a routine, a schedule of specific sensory activities that the child needs to utilize throughout their day to help them feel organized, and see if that helps. Again, tailor to that child. If it doesn't, then maybe it truly is ADHD. We need to follow up with the medication route. But again, with the world that we live in now, we're seeing so many more kids that are missing on these opportunities and these chances to explore their environment and develop their sensory system appropriately, that we are seeing a very large rise in this diagnosis, where really it could just be the sensory processing challenge. And the next one. Okay, so what is a sensory integration approach? So this is just truly talking about kind of like, as an occupational therapist, what are we doing? We are really truly trying to figure out how the body gets organized and how the child learns best to make appropriate adaptations and develop appropriate strategies to help them be successful. So through evaluation, we're doing a lot of parent report. Hey, tell me what your day looks like. Where are things falling short? What's happening with their coping? Are we having meltdowns? What routines are most challenging for you guys? Putting them through different exercises and doing those clinical observations, putting them through exercises and activities that require balance, that require strength training, that require them to touch a variety of different materials, putting their heads in different positions. We're putting them through all these different things to see if there's anything that would come up as a red flag as, oh, that was a little tough for that kiddo. They may have, some over-responsiveness to this type of input. And we also like to give our families a questionnaire that looks at their sensory system in a more objective manner that, compares to same age peers. It's looking at their overall type of responsiveness. It helps us tease out, is it seeking, is it avoiding? Are they showing some sensitivity to it, or just decreased registration or awareness of this input? Again, I always take this with a grain of salt because some families just truly aren't aware of it. So those clinical observations in that parent report is kind of my, I call it like my bread and butter, where that's where I get most of my information. But we do have these other resources that do give us nice information if we need some more support.
And then Kelly, we do have another quick question.
Okay.
When should a parent think about occupational therapy? Her daughter's 5 and she's in preschool at a private school and is just nervous that she's developing coping behaviors that might be problematic in a traditional setting.
Absolutely. So I would say earlier the better, because in my experience, the longer that you wait, these coping behaviors or behaviors in general turn into learned behaviors, and it's always hard to change behaviors the older they get because they've been doing it for X amount of years, X amount of months. It's very hard to do that. Again, when we get to a certain age, if they're not intrinsically motivated to change, it's going to be very challenging, which as we get to our teenage years, that happens. And in a few future slides, I talk about specific regulation programs that we utilize with sensory processing and behavior that help us develop those appropriate coping strategies while also looking at that sensory component. So I had kiddos coming to me as young as 2 that were showing some behaviors, and we were working on their sensory system, providing family with behavioral coaching strategies to implement so that we wouldn't have more challenging behaviors when they're 5 or 6. But if you're just starting to see it now, I would say it's not a bad thing to look into, get some, recommendations. I would say hopefully they're working with a regulation program to give you guys tools to utilize at home. But I would say the sooner the better, because again, the longer these kids are maybe doing maladaptive coping or behaviors, the longer they're going to be ingrained and the harder it is going to be changed down the line. Okay, so this is an example of a kiddo that was coming for occupational therapy, had pretty poor body awareness. His sensory system was kind of all over the place. We're trying to tease out what type of input he needed. So what you'll see, the first video is the very beginning when he started this activity. You'll see how his body awareness was, how he was able to stay upright. Is he able to manipulate this type of obstacle, starting it you know, from the beginning. So we'll just see what it looks like at the very beginning of it. So not too bad. Oh, and then we fall. So when you see, you know, we're working on the bilateral hand skills, we're working on our vestibular system, our proprioceptive system, that whole body map. We're trying to help him see his body awareness here. Trying to encourage him to utilize the appropriate core muscles to sit upright. And as you can see, a little disorganized in his ability to execute. This is a great activity to encourage crossing midline. And if you can see, his right hand is actually crossing midline, but his left is not. It's kind of staying static. So does he have that true self of body awareness piece? So we'll just keep watching a little bit. I don't know. I think he has a little bit more of a challenge. So we're really only kind of using that one arm.
And Kelly, how old did you say that this child was? Do you know?
You know what? I don't know, but from the looks of him, he looks probably like 6 or 7, 6. I actually never treated him myself. He was never my patient.
Okay. Do you want me to go to the next video?
You can play a little bit more because I think he has a little bit more of a.
Okay.
Yeah, that's fine. That's fine. We're good. Move on to the next one. That's fine. So again, you can see his body awareness to execute is pretty challenging. Now, with those increased repetitions, he's constantly getting that vestibular input. He's getting that proprioceptive input. He's using his visual system. He's engaging his core. The more he does it, his sensory system starts to work together, and he's getting the appropriate input that he needs to execute appropriately. So we'll see after he does the warm up how much more efficient he is in his ability to execute. So a lot more efficient, hand over hand, fluid. He actually is showing so much improvement that he wasn't really focused using his eyes. He was able to kind of manage it with just his arms and his body moving upright. So again, a lot of times it is just providing that the input that the child needs, the appropriate frequency, with the appropriate amount of repetitions throughout their day, that will help them increase their overall sensory processing to feel just right and be more organized to execute whatever it needs to be. It doesn't need to be an obstacle course. It could really truly be being able to sit at a table to complete homework assignments. So this is just an example of one of the therapy sessions that we could utilize. So this is one of our programs that we will utilize to help increase kids' awareness of their sensory processing system. So this is called the ALERT program, or How Does Your Engine Run? This is one of my favorite programs that I utilize with those kiddos that are maybe described as sensory seeking or bouncing off the walls or hard time sitting still. What this does, it teaches kids about that they have an engine, just like any car. Some cars run just right. Some are really, really fast or running really high, and some are running really, really slow or really low. And we talk about how our body is feeling. So they're starting to be aware of how their body feels at different times. Is their engine feeling just right? It's always, it's teaching them, hey, we'll watch videos, or I'll even model for them to tell me, what do you think my engine's running? And then are they able to label within themselves? And then we talk about, hey, well, when we're supposed to be doing our homework, or when we're supposed to be sitting at dinner, what do you think your engine's supposed to be? Oh, it's supposed to be just right. Okay, well, what if it's too high? What do we need to do so that we can get our body to feel just right? So again, getting these kids to be more intrinsically motivated to master their environment, to learn the strategies that they need to do to be successful, to be able to adjust their engine speed. Again, we can adapt it for younger kiddos. Obviously needing a lot more support from mom and dad with that, but we'll utilize this a lot with just helping those kiddos learn how to master their own sensory system. And then our next program that we talk about is the zones of regulation. And this is one that I jumped in my head earlier with the one question. This zones of regulation looks a lot at that emotional regulation as well. So developing appropriate coping strategies during those meltdowns. So what this is really nice at doing, it talks about our emotions, and it breaks in our emotions down to 4 colors. So we have our blue, yellow, red, and green. Green is when we're calm, we're focused, we're ready to learn. Blue is when we're sad or tired. Red is when we're angry, or maybe we're bouncing off the walls. We have no control over our body. And then yellow, yellow is kind of tough sometimes, depending on the kids. I'll get rid of yellow, but yellow is either you're really frustrated or nervous, or you could be a little silly. So we sort our emotions based on color. I've noticed this helps a lot with those kiddos that will just go from 0 to 100. They're not being able to either articulate how they're feeling or identify like what they should be, what's an appropriate coping strategy. So this helps them be better at identifying how they're feeling with the family. So, hey, I'm in the red zone. I don't know how I'm feeling. I just know I'm in the red zone. Okay, well, what can we do to help you get back in the green zone? Again, giving them some strategies to help be more successful with that. We have a lot of other different programs that we'll utilize for younger kiddos. We have like the Superflex program that teaches kids about being a superhero, and there's different villains that jump into our head. So again, we're not behavioral therapists by any means, but because sensory processing and behavior go so closely together a lot of times, we have developed certain programs that will help develop appropriate coping strategies so these kids can, master, those challenging times appropriately. And again, adapting it to the age of the kiddo. I had to do this once for a kid where I did it with a very, very, very smart 2-year-old, very advanced language-wise and communication-wise. And we did the zones. We did green and red. That's what we did. We just broke it down to 2, and she killed it. She did a rock star stuff with it. So again, we can adapt it how we need to, but I find that this is very helpful, a helpful tool to help those kids be more motivated.
And then Kelly, one of our questions, do you ever let the child create their own colors for feelings? Example, purple for when they're feeling calm and happy.
You can, absolutely. That works for the family. I would say there's no problem about doing that. It's hard to generalize. If you bring it to school or to an OT, and the OT is trying to teach the specific colors. I know I've taught a lot of teachers about this, and they'll try to utilize it in their classroom for the entire classroom sometimes. So again, it can be hard to generalize if other people are using it, but if it works for your family, I think that's great. What I would say is make visuals though. Visuals are super helpful. So that's what we do when we do these programs. We provide kids visuals so that they can kind of utilize that to communicate how they're feeling and move. Maybe it's a zones meter and they're moving a little meter to tell, I'm in the red zone right now, or now I'm in the yellow. Another support to help them feel, being able to communicate how they're feeling. So I don't think there's anything wrong with it. Whatever works for your guys' family, if it works, it works.
And then how would you modify this for a speech challenge 2-year-old?
So again, it definitely depends. I may not utilize it for some kiddos. I may not at all. I may just provide a lot of parent coaching, a lot of sensory integration techniques. I couldn't get over how advanced this one child was, and that's why I utilized it. Otherwise, I would be doing a lot of parent coaching. In my experience, the ages of 1 to 3, majority of my regulation kiddos is getting the family involved and doing a lot of parent coaching and how are we responding to certain behaviors and how are we redirecting them. We may not need a specific program. I have done for some of my younger kiddos just visuals of happy and sad if they need to communicate how they're feeling. Could they have a visual that has a happy face or a sad face and just rate themselves just to be able to communicate. That should be another strategy you can try to implement. Again, but it's very specific on the child. I wouldn't typically, if a kid has some language or delays, I probably wouldn't use this because it can be kind of complex. I would maybe do something simple like happy face, sad face, angry face, and just have them try to be more aware of just emotions in general. So this page is very important, and if I could, say anything, these are the resources that you should be looking at. They're great resources. The worst thing that I can have is families coming to me and saying, "Oh, I Googled this and I Googled that." There are so many scary things on the internet that are not providing the appropriate information for families. These sources are great. They help you give great ideas about, how to understand your child's sensory system, different activities to implement to help your child's activity or sensory system. These are the resources that you want to look for. Anything that's done by like an OT are the answers you want to try to find. So I would say screenshot this page, and if we can send it to you, we will. But these are the things that you want to kind of make sure you're looking at. Don't go Google crazy, because that can just spiral. And again, more online resources. These are great resources you guys can just find out online. These are places that will give you appropriate information, different strategies, different activities. These are really great resources that, again, save this page for you, spend some time looking into it. I refer a lot of my families to these types of resources as well. Well, that's about it. So again, thank you guys so much for having me. Sensory processing is so broad. It covers so much, and it's really hard to even just kind of dive into it within like a hour presentation. But please, if you have any questions, please shout them out or type them out. And I can try to answer them, but I appreciate you guys letting me speak with you.
And then we actually do have 2 other questions that were actually asked earlier in the presentation. One, can an under-responsive child develop a habit of seeking because they are getting attention for their loudness? I'm assuming this was back during the auditory slide.
Okay. So can you repeat that? So can an under-responsive child, repeat it again for me?
Can an under-responsive child develop a habit of seeking because they are getting attention for their loudness?
So it might not be seeking, it could be like seeking attention, right? So if it's truly a sensory system, they wouldn't do it for attention to like try to seek, but they could develop a learned behavior to seek attention by doing X, Y, and Z. So so it wouldn't it wouldn't turn into it. It either is or it isn't when you think of sensory processing, but could that learned behavior look that way? Absolutely.
Okay, great. And then lastly, do you know if wraparound services support sensory needs / sensory integrative approach in addition to behavioral needs? Particularly, if sensory needs can help prevent behavioral issues from developing. Sorry, I had to reread that for a second. Do you want me to reread it, or?
Yeah, I think I got it. So I'm not sure. I know that for wraparound services, I'm pretty sure you're just getting like a behavioral therapist that is addressing some behavioral concerns. I know I work alongside a lot of those. Like we have families that come to me that also get wraparound services that I'll try to reach out to those supports to educate them on what we've done that has worked well that's related to sensory, but I can't say that they do or don't. There may be some really great wraparound service clinicians that are trained in sensory integration, but from my knowledge, not that I'm aware of. Usually it's through an OT that they're providing that information for. And yes, to your question is, could sensory help prevent some of those learned behaviors? Absolutely. Now, I do have kids that come to me that are coming for quote unquote behavior, some sensory processing challenges. They think they're not sure. That's my job to find out. And I see that there are some sensory challenges going on with kids, but I also see that there's some strong behavioral challenges going on here. And the parent, and these are typically our younger kiddos, and the parent coaching, it's only going so far, and they're too young to do any of these regulation programs. So I may refer out to wraparound services. I may still see them to support them with the sensory integration approach and provide that information to the behavioral team. But I will absolutely refer out if I do truly see a learned behavior that I can't just kind of nip in the bud, but just with just sensory integration approach.
Perfect. And then lastly, is sensory processing disorder part of autism spectrum disorder? Can you talk about the relation?
So they're separate. So if you have an autism diagnosis, you may not have a sensory processing diagnosis as well. As an occupational therapist, I don't diagnose, so I wouldn't even be able to diagnose somebody with a sensory processing disorder. That being said, the signs and symptoms of autism, a lot of times their neurological system and how that works, they have some dysfunction in their sensory processing. So that's just part of their, again, you meet one kid with autism, you meet one kid with autism. That's the the solid sign there. That's the go-to motto there, where not for every kiddo, but for a lot of kids that have autism, they also have a lot of sensory processing challenges that need to get supported. Now, I can't speak to will they get a specific diagnosis for that or not, but they typically do have neurological differences in their sensory processing.
Okay, and then I think that we have, we are running close on time. We do have 2 other questions that I'm hoping we can get to. I think they'll be helpful. The one is, what else could be used for an under-responsive 2-year-old who has used a compression shirt with varying results? What SI would assist with this, depending on behavioral issues?
Say the second part, sorry.
It says, what SI would assist with this?
Yeah.
Depending on behavioral issues.
Right. So there's a few questions I would have. If you're wearing a compression shirt, sometimes this works great for kids, sometimes it doesn't. There's also things called compression vests. Now, they're a lot more expensive. The biggest thing with compression shirts, and this is for all ages, compression shirts, are you doing it in intervals? Are you doing it all day? Because again, you don't want the kid's sensory system to find that deep pressure as what's considered normal. This is why I always get worried about, the weighted blankets that are out there. They're not providing the appropriate education to families that, hey, weighted blankets are great to calm, but if you use it every day, all day, your sensory system is going to now take that as that's the normal feeling of what a blanket feels like, and it's no longer going to have the same neurological results that it did initially. So I would say for that would be my first question. Are you doing it in intervals? The other thing is looking for opportunities for them to get some other ways of deep pressure or proprioceptive input. Like I mentioned before, proprioceptive input is one of the most regulating inputs that you can get. Could they, do animal walks? Could they do a bear walk when they're walking from their bedroom to the bathroom to brush their teeth? Just getting some more input in their day. The biggest thing is these certain strategies like weighted blankets, weighted book bag, compression vests, compression shirts, they're great strategies to implement in the moment. But what I always tell families is these kids, if they're having a sensory processing challenge, they probably need a sensory diet developed. So that means that finding out a routine of specific exercises and activities that they can do to help keep them regulated so that when we have a huge upset, we're not going from 0 to 100, we're going to be more regulated, that our response may be 0 to 20, 0 to 50 even. So that would be my biggest thing, is trying to find ways throughout his routine or her routine that you can provide input in a more casual way, pushing things, pulling things, walking around like an animal, things like that. But again, if you're looking for specifics and you're having a really hard time, I would consult with an occupational therapist and they can help work through that with you.
Okay, great. And then this is the last one. If your child has challenging behavior, should a family insist on having an OT evaluation along with a functional behavioral assessment?
So if your child's having behaviors, I think either or would be fine. I would ask how old the kid is for like the behaviors. Because again, if they come to me, it could be a very strong learned behavior that I might not be able to change, but I can address some underlying sensory issues that we didn't even know were a thing. Sometimes I'll ask families questions of the evaluation. They're like, oh, actually, yeah, that does bother them. Or, oh, you know what? I never thought of that. Yeah, that does bother them. So, okay, so there might have been some underlying sensory issues that we just never knew about. I don't know if one or the other, or, you should pick one or the other. I can't speak to that, but if your kid is having behavioral issues and you feel that, some of the talking points I mentioned today may hit him on the nail, maybe even just like 1 or 2, might not be a bad idea to consult with an OT.
Okay, I believe that is it. So we will end it there then. Thank you all so much for attending. just so everyone knows, we will be sending out a link with a copy of the webinar where you can go and access it on our YouTube. I also did have some people ask for the online resources, Kelly, to be shown again, as well as the books, I believe, that
Great.
you, yes. So they will be